Hi, everyone. My name is Kaya. I am the director of the Longevity Roadmap docuseries, and I'm joined here today with Drew Perowit and Darcy Gross, and of course, the expert himself, Mark Hyman. And this is our first ever Dr. Hyman Plus Ask Me Anything, and this is the first of many. So continue to submit your questions at Dr. Hyman Plus, and we'll keep doing this. So let's get started. I'm going to pass it over to Drew for the first question.
Great. Thanks, Kay, and welcome to our Dr. Hyman Plus audience, and welcome to the man who is the plus, Dr. Hyman. We have a bunch of great questions here from our community, so I'm going to jump right in with one of the very popular questions that came in. In this world of COVID-19 and all things pandemic, people are trying to make the right decision for their health, and a big part of that includes making the decision around vaccines and how to go about it. And I want to start off with, you did a whole podcast on it, so we will cover some of the topics you covered there. But really, first and foremost, people want to know from your perspective as a human being and also a doctor, but you're making a decision for your personal health. Is Dr. Hyman planning on getting the vaccine? And if so, when would that be, or how is he thinking about it?
Oh, you go right for the hard question right away. Just no messing around. There's no warm up. There's nothing. Just right in there. Give me the tough. So the answer is a qualified yes, and I will qualify what I mean by yes. First of all, what's going to happen to our society is there's not going to be a vaccine mandate, but if you want to travel, if you want to go to a restaurant, if you want to get on an airplane, if you want to book a hotel, if you want to rent a car, you might have to have a vaccine certificate. And those are decisions that individual businesses will make. And I think that's going to drive who decides to get a vaccine or not. With that said, I think the vaccine world right now around COVID has a lot of good science around it, but it's still a little bit like building the jumbo jet while you're flying it, because we don't have real long-term data on a lot of the questions that are still persist out there about vaccines. So let me sort of just give you like a primer on what the vaccines are and how they work and what we know and what we don't know. Now there's about 5 different phase 3 trials and clinical vaccines that are sort of really happening right now. There's the Pfizer, Moderna, AstraZeneca, J&J, and there's others actually that are emerging from China and Russia and so forth. So there's a bunch in the pipeline. They're different. Some are mRNA vaccines, some are adenovirus vaccines, some use other technologies and vectors to get an immune response. So it's not like there's a uniform vaccine that works. For example, the AstraZeneca vaccine turns out not to work against the South African variant, whereas others might. So we're sort of in a learning curve. But here's the framework. There's vaccines, for example, that cause permanent immunity, like the measles vaccine. So you would get a measles vaccine and you'd get it once and you're done for life. You should never get measles again. And that is what we call sterilizing immunity. Then there's a flu vaccine, which you keep having to get year after year. It doesn't actually make you permanently immune. And it also doesn't prevent the flu all the time. It may reduce the severity of the flu. And coronavirus vaccines are very much like the flu vaccine in the sense that they're for respiratory viruses. They are something that probably won't lead to long-lasting immunity. So meaning you might have to get the vaccine every 6 months, every year, 2 years, who knows right now. It doesn't actually prevent you from getting the infection. So it maybe reduce your risk. So there's 40% of people in some of the vaccine trials that got COVID who'd already been vaccinated compared to the placebo group. That's a lot. There's also evidence that if you get the vaccine, you can still get it again if you've already had it. In other words, if you had COVID, you got the vaccine, well, you can still get COVID again. It also seems that there may be, maybe reduction in transmission. It doesn't eliminate transmission. So you could get the vaccine and you could still be asymptomatic. You could still be mildly symptomatic and still spread it. So it doesn't mean that you can kind of walk around as if you're immune and you're never going to get it, and then you might have it and spread it to somebody else. So it's really quite problematic. And I think, from a public health point of view, if 90+% of us got the vaccine, it would make a big difference because it would lead to a reduction in the overall caseload, the hospitalizations, the ICUs are buckling. I mean, it was heartbreaking. I was listening to NPR or some radio station the other day, and there was hospital in Ireland that was just overwhelmed. And the whole system there, they have 900 ICU beds. They're all overflowing. They're having to ship their patients to Austria and using military planes. I mean, it's horrible when the healthcare system just can't handle it. So that could happen. But the truth is that 90% of the population is not going to get vaccinated. So what is that going to mean? Well, it's going to mean that probably half will get vaccinated, half won't be. And the half that is vaccinated will probably feel great. And I'm like, I've heard these people say already, I'm going out now. Like, I'm fine. And they're going to start infecting everybody else, even though they're mildly symptomatic. And that other group will lead to increasing caseloads, increasing total deaths. The percent of people with COVID dying will be less because the severity will be less, but the total number of people getting it and the total number of people dying will be higher. So I don't think we're out of the woods yet. I don't think vaccines are universal panacea. And in my opinion, they're one part of the puzzle to help address COVID, including, obviously the mitigation strategies, which, while not perfect, are effective. But even more so, I mean, I just got a text this morning from, one of my friends, colleagues, whose husband, who's, an African-American guy who's very overweight, who's extremely high risk, got COVID. And I said, okay, immediately start on this, eat this way, take these supplements that are, directed to COVID, like vitamin A and vitamin D and zinc and vitamin C and quercetin and a number of other things that we know from the data are helpful for immune function or antiviral. And she said he was mildly ill for a couple of days and then he was better, and she was with him in the house and she took the supplements and never got sick and never turned positive. So I think we have a lot to learn about how lifestyle, nutrition, and upgrading our metabolic health can help us to become immune resilient and prevent us from actually getting the virus and even lead to a better outcome. So, and we know from early data, for example, around vitamin D, you're 80% less likely to get, 94% less likely to get into the ICU and die with COVID if you have good vitamin D levels. And if you have low levels, you're 80% more likely to get sick and die. So that's a simple intervention that can really dramatically help. And when you combine them all together, you basically help to reduce the overall inflammation in your body and get healthy. So are vaccines going to save us as it seems to be, reported in the press? My opinion is no. Now, the question is, will I get the vaccine? Which I'm trying to avoid, but I will not. And the answer is probably yes. Probably right now, I'm right now sequestered pretty well away from people and don't really plan on traveling. But if I get back in circulation, if I'm starting to see patients again, if I'm being exposed or exposing others, I certainly will plan on it. And I also think, I'm going to wait a little while, and I think we're going to learn more about, what the vaccines do and so forth. So I'm not in a rush, but I'm not opposed to vaccines. And I generally don't like the idea of, the massive amount of vaccination schedules that we have in America. I think they're a little bit of an overreach, and I think the vaccines are a really important public health measure. But I remember being at a conference with a pediatrician from University of California, San Francisco, who had to present the schedule, and this was even years ago before it was even bad now as it is today. He says, there's a lot of vaccines. I have to tell you, this is what the Academy tells me I have to tell you, but it's a lot of vaccines to give little kids. So I think we're still, we talk about evidence-based medicine. I think we need to do more research on vaccines and how they affect people and the implications of who would benefit and who wouldn't. And in fact, Mayo Clinic has a whole field of vaccinomics, which is personalized vaccination strategies. So I think there's a lot of conversations here, but at the end of the day, I think, yes, I'll get a vaccine and I'll wait a little bit until, I'm at a higher risk. And then I also understand that it's not the panacea that we all hope it will be. But I hope I'm wrong.
That's a great answer. Very robust and straight to the point, Mark. On the topic of vaccinomics, which I feel like is something interesting that functional medicine has to bring to the table, which is it's already been established that there are certain people that there's maybe not as much evidence with when it comes to the COVID-19 vaccine. For example, pregnant women, right? So there's an individual choice. Talk about it with your doctor. In the world of functional medicine, they are good, and doctors like yourself are good at identifying people who are frail in the eyes of functional medicine, but would not be considered frail in the eyes of Western medicine necessarily. What are some other categories of people who really should be having a discussion with their integrative or functional doctor if they're worried that they might be in this frail category.
Yeah, I mean, I think you mentioned pregnant women. I think look, when you do large studies, these are studies on 20, 30,000, 40,000 people, which sounds like a lot. But when they do a study, they try to sort of create, fair cross-section or homogenization of the patient population that they study. And so you're really only looking at those people. When you start to give it to not just 30,000, but 300,000, 3 million, 30 million, 300 million people, all of a sudden you're in a different ballgame. You can't say there's evidence about how that's going to work. I mean, if you have autoimmune diseases, if you're pregnant, if you're children, if you're a child, I mean, these groups have not really been carefully looked at. So we need to start to get more data on what happens when you have various conditions, whether you're, for example, a very highly allergic person, or have an autoimmune disease, or you're pregnant, or maybe you have cancer. Or we don't know if you're on immunosuppressive medication for various conditions. So I think we really don't know, and I think it's a matter of time before we start to get the data in. But I'd be cautious about some of these subpopulations, and I would really focus on the things that we do in functional medicine, which is how do you create immunoresilience. And at the very start of the pandemic, I wrote a blog called how to use functional medicine to approach COVID-19, and I think I've learned a few things since then, but I would look back at it and I was like, this is still pretty relevant right now. And it talks about what you can do from a lifestyle perspective, what you can do from a supplement perspective to help really boost your immune system and make yourself more immunoresilient.
When you prepare, let's say eventually, if you do, as you said, you're not rushing to get the vaccine, but if it's required in other components, or if you start working again with patients, you want to be mindful. So you would get it in that instance. When you do get it, thinking out to that moment, some members in our community wondering, would you do anything additional that you aren't doing right now to prepare for it, or any recommendations that you would have for other folks who are about to get the vaccine?
Yeah, I mean, I think it's a hierarchy of strategies. So, I doubly focused down on my immune system during COVID, and I've had a few immune scares myself. And so I feel, I've doubled down on eating real food and upgrading my diet. I doubled down on getting enough sleep and exercising and meditation. And I doubled down on supplements I'm taking in order to help maximize my chances of having a robust immune system. So I take different classes of stuff, and I'm fairly aggressive. I don't know if everybody has to be, but I think there's the vitamin camp, right, which is vitamin A, vitamin D, zinc, vitamin C. These are well-established immune modulators and can help. And the risk is very low. And then there's the adaptogenic. This is the adaptogenic type of supplements, for example, like the mushroom family, which can really help build immune resilience. They have a whole class of compounds called polysaccharides, which are really quite robust immune modulators and can help prevent infection, can help recover from infection, have been studied in cancer. And so there's a lot of benefit to these sort of adaptogenic products. And then there's a class of compounds that are more I think directed at sort of addressing some of the the mechanisms of action, and there may be coming from plants. For example, like quercetin is a very important derived phytochemical that comes from the peel of oranges or onions, and is a very potent immune modulator, anti-inflammatory, and even antiviral. Various such supplements such as N-acetylcysteine and others that have been shown to be effective. Glutathione levels tend to be low in people who have poor immune function, and in COVID, there's been some evidence that glutathione can be helpful. NAD also seems to be helpful in COVID in certain small studies I've seen. So these things are things that I would often use anyway, but I do think that it's important that you sort of double down on things that really are going to help.
Fantastic. All right, well, I'm going to pass it over to Darcy, who has the next level of questions for you. There's a ton of people that watch the docuseries that are now part of Dr. Hyman Plus. And they're very excited to take their health to the next level, but they may not always have access to a doctor like yourself or a functional medicine doctor. So we have a few questions in that category, so I'll pass it over to Darcy.
All right, thank you so much, Drew. Hi, Dr. Hyman. So we had a ton of people. We had a ton of people writing in, just super jazzed about functional medicine. A lot of people haven't ever heard of the functional approach before. So when they watch this docuseries, it was their first introduction. And it was a whole new way of thinking. I think a lot of us have felt that way, where it's just different than the conventional way of thinking, but yet so hopeful. It really resonates with a lot of people. But we had a lot of people asking, they're just not sure exactly how to find a functional medicine practitioner. And even more so, maybe how you would recommend that they could work either on their own or with their conventional doctor to get a more functional approach. So if you could kind of speak to that.
Absolutely. I think what functional medicine is, first of all, is an approach to addressing your health that focuses not so much on diseases, but focuses on health. What's the science of creating health? How do we identify where your imbalances are that are taking you away from optimal health, and how do you reset those systems so you can optimize your health? That's really what functional medicine is. And so from a perspective of testing, things that I look at are quite different. We do look at all the same regular tests that any doctor will look at, but I do think we look at a layer deeper. And the body is really organized into these 7 key functional systems that are all connected and all dynamically interacting all the time to create health or disease. And so what I'm really curious about is, how are these systems doing? How's your microbiome in your gut? How's your immune system? How's your energy system? Are you making energy effectively? Are you having lots of oxidative stress? Are you detoxifying? Are you overloaded with toxins? How's your, for example, communication system going? What about your hormones, neurotransmitters? How about your structural system, all the way from your cells to your biomechanical structure? And then how are all those affected by your lifestyle and various factors like toxins, allergens, microbes, stress, poor diet, which are often the triggers for disease, and those interact with your lifestyle, and they create imbalances in these systems that then we're trying to look at. So from a diagnostic point of view, if someone's really healthy, I just would look at a broad array of things, but I really want to see what's going on. So I'll look at, for example, their nutritional status as foundational. And often doctors really don't look carefully. What are their amino acids? What are their essential fatty acids? What are their vitamins and minerals? What are their antioxidant levels like? What are their mitochondria look like in terms of how they're dealing with the nutritional requirements that they have? So really, it's a deep dive into nutrition. We also look at the gut, because that's, again, where it all starts. And so we'll do stool testing. We'll look at the microbiome. We'll look at absorption and digestion. We'll look at the immune system in the gut. We'll look at markers of the overall metabolic health of the bacteria in there. We call it dysbiosis or symbiosis. We can get a sense of if you have too many good guys or bad guys, and which ones we should support or get rid of. We also look at the short-chain fatty acids, which are really important as markers of overall gut health and are really determined by a lot of what we eat. So we'll look at all of that. We'll look at, for example, food sensitivities and things that might guide a more personalized choice, because we could say, oh, I want to eat this or that, but you might not be able to because you have a leaky gut or you have different foods reacting in your system. And then in terms of immune function, we might also look at, if you have latent infections like tick infections, depending on your story. Maybe you have other factors of viral infections that are affecting you. Maybe you have food sensitivities and so forth. And then we'll look at your energy system. We'll do testing to look at your mitochondria. How are you producing energy from food and oxygen? Do you have the right nutrients you need to optimize everything? And then, of course, we'll look at your detoxification systems. Are the systems working? Are your levels of glutathione okay? And do you have a toxic load? We'll look at heavy metals. We'll look at pesticides. We can look at mold toxins. We'll also look at the hormones in terms of your communication system. What about your insulin, your blood sugar, your lipids, all those metabolic factors, as well as your sex hormones and your thyroid hormones and your adrenal hormones. So we get a really deep dive into what's going on in your system. And through that testing, I basically get a picture of what the overall level of health in your biology is and how that works.
Okay, great. Thank you so much for that answer. I think that provides a really great framework of functional medicine, so that we can really get an understanding of how to really look beneath the surface and get to know kind of what's going on the inside. So are there like a list of top recommended tests that you recommend that a conventional doctor can order for people?
Yes. I mean, I've written a guide. It's called How to Work with Your Doctor to Get What You Need. I think we have that. Maybe we can share. But I go through literally how you diagnose imbalances in each of these systems, what tests to order, how to navigate to what's going on. So yeah, there's some basic stuff that I would have people do. But look at basic nutritional levels like vitamin D and homocysteine, and maybe looking at B12, zinc, omega-3 fatty acids. Those are really important for hormones. I would look at, insulin and blood sugar and lipid levels. I look at something called an NMR test. I look at sex hormones, thyroid hormones, saliva, adrenal testing. Stool, I would look at sort of stool testing to look at what's happening with that. And for toxins, sometimes you can look at levels in the blood or of various detoxification components like glutathione, or you can actually look for levels of toxins. So we do a thorough look through the whole system, and often it's guided by their story. If someone says, look, I never ate fish in my life and I don't eat fillings, I'm probably not going to do a heavy metal mercury test. But if someone says, I'm eating sushi 3 times a week, and then I'm going to go, okay, we better check that out. Or if someone says, well, I'm living in a moldy house, I'm going to check that out. But if they're like, well, I've never been outside and I live in an apartment in New York, I'm not going to check for Lyme disease. So it really depends on each person and what their story is. So it's guided. It's not just a one size fits all, but there's this really personalized approach to their testing based on their history.
Yeah, that makes sense. Thank you so much for that. And just for our community at Dr. Hyman Plus, we will post that document in Dr. Hyman Plus. So be sure to look for that. It's called How to Work with Your Doctor. So we'll have that posted for you. And just one final question on this, Dr. Hyman. If somebody wanted to find a functional practitioner, where should they go?
Well, a number of resources. ifm.org is a wonderful resource of practitioners who've been certified and or had some training. So they can find a practitioner by their geographic location. There's practitioners trained in dozens of countries around the world. Of course, they can always come see us at the Ultra Wellness Center. We're seeing patients by Zoom and then just ultrawellnesscenter.com. Cleveland Clinic, we also see patients virtually, but it's a pretty full schedule. So I think there's a lot of opportunity now to get to functional medicine doctors, which is far more than it used to be. So I'm very excited that we're seeing the growth of this movement and more practitioners really getting trained and actually learning how to do this.
Yeah, I agree. The more that we can spread this information, the more people can be helped and treated, and it's just creating a really amazing future for sure. Mm-hmm. So kind of on these same topics, I'm going to hand it back over to Drew for our next question.
Great. Awesome. So Mark, we have another question for a member from our community. It's a little specific, so I'll read it off here for you. So I've been diagnosed with osteopenia, and I want to stop the further decline in my bone density. My mother had osteoporosis and took medication that had horrible side effects and still suffered multiple bone fractures. I'm looking for a more natural and holistic way to fight this. What would be the functional medicine approach to restoring bone density?
Mm-hmm. Drink milk, right? Maybe not. So let's talk about it. This is, it's interesting. As we start to learn more about diseases, we learn about how there's so much rooted in inflammation. And we used to think of osteoporosis just as sort of a mechanical problem. It's just loss of bone calcium, and you put bone calcium back and everything's good. It turns out it's not so simple. And that, in fact, there's a lot of inflammation going on in the body that can drive osteopenia and osteoporosis, which is the thinning of the bones. And so sometimes just getting to the root of that is really key to treating it. And it's something that most providers don't do. But even before you get into that, we live in a bone dissolving culture. I mean, there's some countries that maybe get very little calcium, like 300 milligrams of calcium, and they have almost a day and they have no fractures. And the government here says we need 1,500 milligrams of calcium, and we're still seeing so many fractures. So what's the problem? The problem is that the behaviors and the habits we have drive bone loss. For example, caffeine, alcohol, sugar, salt, which is abundant in processed foods, phosphoric acid, which is in all the colas, stress. All these things cause our bones to dissolve, and so we can change our lifestyle and adapt that to help our bones and live a bone healthy lifestyle. That's really important. The second thing, obviously, is exercise. We don't move in this country. We sit, and often we don't do strength training, and so it requires definitely force against the bones to stimulate them to grow. Even if you take all the right nutrients, even if you take all the vitamins and minerals, even if you eat the right diet. It's almost like putting a bunch of ingredients in a pot on the soup and not turning the heat on. The heat is the exercise. It's how you actually start to stimulate the building of new bone. You need to put resistance against it. And that's really strength training. But I've seen people do it by, when one was in her 70s, she gained like 10% bone mass simply by doing, yoga every day. And yoga was very, very good for her because it strengthened her and built her bones. So I think there's fundamental lifestyle issues. And then of course there's the right supplements. And I think most of us are, thinking about calcium because it's what we've been brainwashed to believe. But it turns out that calcium may not be as important as we think. In fact, may not have much of an impact at all on bone density. and that also, the milk story is a problem because we have been brainwashed to believe that we need 2 to 3 glasses of milk a day in order to build strong, healthy bones. Well, I never liked milk. It's not why I'm against milk today, but I never really liked drinking it. It just tasted horrible to me. And, I'm 6'3" and I have pretty strong bones. So I wondered if maybe I would be playing basketball instead of being a doctor if I drank a lot of milk, but I don't know. And I think that the data on this is pretty striking. If you look at, and I talked about this in the Vegan Diet book, which is coming out the 23rd of February, that the science shows that if you actually have a glass of milk, your risk of fracture goes up. And so the more milk you drink, the more your risk of fractures go up. So it's pretty crazy when you think about how we've been so brainwashed to think that milk is nature's perfect food, and it really isn't. Maybe if you're a calf, but definitely not if you're a human, and it's definitely not the best source of even of calcium for your bones. So there are other sources of dietary minerals that you need. For example, calcium, magnesium, zinc, of course, vitamin D, and the boron, and so forth. And so I think we can get all those from different foods, but we also may need supplements. And calcium, for example, you can get from other great foods, like, for example, tahini, which is ground sesame seeds, probably the highest source of calcium. Chia seeds, serving of chia seeds has more calcium, and it's probably more bioavailable calcium than a glass of milk. And of course, there's things that I like sardines or salmon with the bones in them. That's often how people who lived on islands would get their calcium. But what turns out is more important is the vitamin D. 80% of us are deficient in vitamin D. And that vitamin D deficiency really causes massive havoc with the bones. And there's a simple home test you can do for vitamin D. Just take your thumb and you press it as hard as you can into your shin. Now, if it's tender or soft, it means you have vitamin D deficiency. Everybody go down and do that. Why? Because it not only does vitamin D help with osteoporosis, it helps with osteomalacia, which is the softening of the bones. And so if your bones are tender or soft, I can push hard as I want on my calf. On my shin, it doesn't hurt at all. But if it really hurts, then there's a problem. And I think, of course, you want to make it a blood test to confirm that. But it's a cheap home trick you can use. And we do need vitamin D levels between probably 50 and 75. If you looked at that cutoff, probably 90% of Americans would be deficient or insufficient. Levels 45 or more are really what was considered adequate. Under 30 is pretty deficient. And again, it's a hard one to do because unless you're laying on the beach and on lifeguard every day, it's really hard to get enough vitamin D without taking supplements. It's in milk, but it's not really in milk. It's been fortified and put in milk. You can get it from porcini mushrooms. You can get it from things like fatty fish, like sardines, herring, but not in huge amounts. So I think we all evolved basically half naked, running around outside hunting and gathering. So we're used to getting a lot of vitamin D through our skin. We don't do that anymore. And I think we really need to double down on the vitamin D, particularly in not just for osteoporosis, but for COVID as well. So I think taking, the lifestyle measures of eliminating the bone dissolving habits, adding in the right foods that are nutrient dense with, calcium, magnesium, zinc, vitamin D, boron, and so forth. And then and vitamin K2, I didn't mention that, but that vitamin K2 is also very important. And then making sure you do the right kind of exercise, which essentially is resistance training. It could be bands, it can be body weight, it can be yoga, it can be weights, but it's really important to be consistent, particularly as you get older, because you lose tremendous amount of muscle. So I think then you need the right supplements. And so it's basically a good multivitamin, vitamin D, it's probably magnesium. I don't really recommend calcium supplements that much to people anymore. I think they sort of not necessary. If you focus on dietary calcium, it's better used. And also a lot of the calciums that are taken are not that absorbable, like calcium carbonate. So, and then of course I'll recommend vitamin K2 and a little boron and silica. And there's combination bone building supplements that I'll recommend for patients.
Great answer. One follow-up on the question of exercises with gyms being closed in a lot of places as well. In your example, you're traveling a lot. You're not in your sort of home area. What are the actual exercises that you do that are resistance training based that are doable? And what's your frequency at the stage of life that you're in right now?
Well, true confessions. My whole life, I've really hated strength training. I've avoided it. I talk about it. I write about it, but I wasn't doing it. I was doing yoga and I thought, that's good enough. Yoga's good. And it was good enough. I mean, it was good. I bike ride, play tennis, hike, ski, do pretty much everything else. But, when I turned 60, I'm like, all right, I better double down here and get serious. And I tried different things and I loved going to the gym, but then COVID happened and it was really challenging. And I discovered a system which use a band system using handle bands and loop bands. And really all you need is a portable little kit of bands and things that hook on a door. And I got this through Tom Brady's rehab and training program after I had my back surgery called TB12 Sports. And, and I work with a Zoom trainer for 30 minutes, 4 times a week. And it's changed my life. I have no more back pain, which I used to have all the time. I have more energy. My strength is much better. And I just see my body changing, which is really striking to see at 61 that you can still, physically rejuvenate, repair, get stronger, fitter. It's just the most interesting thing to me because, you all learn that aging, you sort of go downhill. And I actually am way stronger and fitter than I am now than I was when I was 30. And I feel like a lot of it has to do with this sort of last, almost year of doing this training, which is really profound. And I can travel with it. I can go anywhere. I got a portable yoga mat that's fold small, fit my suitcase. Well, I'm not traveling anymore, but when I do, I take it with me. I just take it wherever I go. I grab the bands and then I can jump on Zoom wherever I am. It's really become a sort of a staple of my fitness routine now.
Fantastic. Great. Thanks, Mark. I'm going to pass it back over to Darcy.
I mean, listen, it works for Tom Brady. He won his 7th Super Bowl, so it's I'll take it.
Yeah, you got me hooked on it. So I've been doing it. I don't know if you know, since you came.
I do.
4 times a week as well. So.
And how's it going?
Yeah, I love it. It's easy to do. It's at home, and it's not that this is a plug, but it's actually like quite affordable if you're comparing it to other personal training.
Oh, it's incredibly inexpensive. Yeah.
Not crazy expensive for anybody who's worked with personal training. I think it's like about $50, and you can look it up, TB12, and they have their workouts, their virtual workouts.
Yeah, and they actually TB12 Sports, and they actually have an app where if you buy the equipment, you can just do it on the app too. I get a trainer because I've had various injuries and things, and I'm sort of working on specific things, but a lot of it you can just do with the equipment in the app. So I think it's very accessible, it's very affordable, and I think it's also nice because it doesn't load up your biomechanics because the bands are different than carrying heavy weight, but you still get a tremendous amount of resistance and strength training from it. Fantastic.
Thanks, Mark. Back to Darcy.
Awesome. I love this. This is really informative. So thank you so much. So we're going to kind of switch gears just a little bit and talk about the ketogenic diet. I know that a lot of people have been very interested in keto lately. And it seemed like about a year or 2 ago, people were mostly interested for things like weight loss. But as the more research has come out, it seems like ketogenic diets have been beneficial for conditions like cancer and other conditions like that. So of course, there's a lot of questions surrounding this diet. And so this is kind of a 5 or 6 part question, but part 1, having to do with some of these conditions is the ketogenic diet right for everyone?
No. I think that what I've learned and been humbled by as a doctor who's seen tens of thousands of patients and run millions and millions of data points through lab testing and listen to people's stories and watch their responses to diet over time. And, I've gone through all of it. I've been, vegan, vegetarian, low fat, high fat. I mean, I've seen the patients go through these trends and try it on themselves and really gotten the privilege of having an inside view on what really happens. Not, what you read in a book, not what some study says, but actually what happens with people. And so at the end of the day, it really reflects the foundational principles of functional medicine, which is, it's personalized medicine, it's personalized nutrition, it's precision nutrition and personalized nutrition. That's what we need to be focused on. And so the question is, how do you find the right patient for a keto diet, and how does someone decide if they're the right candidate? So I would divide it into, a therapeutic diet, as a performance diet, and then like who shouldn't potentially do it at all, right? So from a therapeutic diet, it's extremely effective for metabolic health. It's extremely effective. As a therapeutic diet, it can be profoundly effective for people with poor metabolic health, which is about 88% of Americans. 1 in 2 of us have prediabetes or type 2 diabetes. And it turns out that, your body, just for those who don't know, kind of is like a hybrid car, right? It can run on electric or gas. So electric is the keto, and the gas, which is a little more dirty burning, is the carbs. So your body can run on sugar or fat. And it takes a bit of time to convert over to total fat burning, a couple of weeks, but it's what's known as the keto diet. And when we eat a lot of starch and sugar, we produce massive amounts of insulin. Insulin is a hormone that you need to keep your blood sugar in balance, but when it's too much, because you're overloading your system with tons of starch and sugar, which we eat about a pound of a day per person, you end up in this cascade of poor health, right? You store belly fat, the fat's inflamed, it makes you hungry, the fat gets locked in the fat cells. Literally, you can't get the fat out as long as your insulin level's high. And it's really required for you to actually sort of shift into a better metabolic health to lower the insulin levels. And it's an example of, it's not about the calories, it's about the hormones. And this is a theory that, is sort of, I wouldn't call it a theory because I think that's pretty factually based, but it sort of flies in the face of what we all learn, which is all calories are the same. I think, well, how can I eat fat and not get fat and not cause this and that? Well, it turns out if you cut out the starch and sugar and you eat fat, the insulin levels drop. And if your insulin's low, then you start liberating fat from your fat cells, losing belly fat, building muscle, reducing inflammation, improving cognitive function, improving your lipids. It just creates all these better effects, improving your hormones. For women, it helps to fix their abnormal testosterone, which can lead to facial hair and acne. And for men, testosterone levels will go up as they increase their fat in their diet and decrease starch and sugar, because as your belly grows, your testosterone goes down for a lot of reasons that I can explain later. But essentially, we have this cascade of effects from too high insulin, and a ketogenic diet will just shut that off. For example, if you look at type 1 diabetic, if they are different in that they make no insulin from their pancreas because their pancreas has been attacked as part of an autoimmune disease that makes them unable to produce insulin. And if you're a type 1 diabetic, you could literally eat 10,000 calories a day and lose weight. You could, and why? Because you can't store anything unless you have insulin. So the best way to get, and they're hungry, they're eating all the time. So when you say it's all about the calories, calories in, calories out, that theory doesn't make any sense, right? So we call this carbohydrate insulin hypothesis or hormonal hypothesis of weight metabolism. If you have high insulin, which many people do, and it's a test that most doctors don't check, they should check that, and it should be less than 5 fasting and less than 30 after a meal or a sugar drink. And if it's higher than that, it means your body's working too hard to keep your blood sugar down. You produce more and more insulin, and that creates these negative effects. So the keto diet just shuts that off. And so you can't store fat very easily. You have to mobilize it. And it creates all these wonderful benefits. And the data on this is really impressive. There's more and more data on low carbohydrate, higher fat, our ketogenic diets for all kinds of poor metabolic health. For example, Virta Health is a company that does online treatment for type 2 diabetics, giving them ketogenic diets with coaching and support. These are people who are on insulin, who are severely overweight, who've been diabetic for a long time, and are treatment resistant, and pretty much are, quote, managed with a pile of medications. Well, what's striking is in these studies, and these are now multiple years out, there was a 60% reversal, not just improvement, but reversal. No medications, normal blood sugar, in 60% of these people. 9% got off the main diabetes medication. Over 90% reduced or dramatically stopped the insulin. The average weight loss was 12 pounds, even though it was, quote, a weight loss study, which is, when you think, not 12 pounds, 12%. And when you think, 12%, that's not that much. But, in a study of weight loss, if you get a 5% weight loss, that's magnificent. We love that. It's rare to see that big of a change. And you're talking about 12%. It's unprecedented in terms of weight loss. And what was interesting, more even interesting in this study by folks at Verta Health and the clinical trials they did, was that they looked at, I think, 26 biomarkers of cardiovascular disease. So, lipids, cholesterol, blood, all the things that you think would be the things we should watch out for, because you're eating all this fat and it's going to clog your arteries. And maybe your blood sugar goes down, but you're going to get a heart attack. Like 22 out of the 26 got better. Not just didn't get worse, but actually got better. And I think the rest were just sort of neutral. So that's a dramatic finding, and that's all been published in the medical literature. So I think for that class of people, if you're a type 2 diabetic, that's a very powerful therapeutic diet. Another class of patients who seem to do really well are people with neurologic issues. And the first use of the ketogenic diet in medicine was for epilepsy. So when all medications fail, the best of modern medicine doesn't work, guess what? We use food. It's sort of last resort. Should be the first place we start. But they use ketogenic diets because it really fixes the brain. It stabilizes the brain electrical function and helps prevent seizures. It turns out it also seems to be very helpful in autism, in Alzheimer's, in brain cancer. And so we're seeing really dramatic improvements in these patients. And I've seen it myself in autistic kids and patients with Alzheimer's. And I wouldn't say it's curative, but it definitely can dial back the clock and help people improve their function. And I've seen people just literally wake up and come back. And brain cancer and other cancers is another category that seems to be very effective. And there's some great work being done on ketogenic diets and cancer, particularly, in animal studies, melanoma, stage 4 pancreatic cancer. I mean, real dramatic things. So I think there's also evidence that it might be really helpful for people who are going through cancer to minimize side effects of chemo and radiation, to have better outcomes from the treatment. If you have to go through traditional treatment, when you combine it with food, when you combine it with a ketogenic diet, you're actually accelerating your recovery and reducing side effects and improving your long-term outcomes and risk of really getting over this. With that said, Darcy, there are different ketogenic diets, right? I have a friend who's a vegan keto. I have people who say, well, I'm just going to have, ribeye and ribs and cheese and bacon, and that might not be the best strategy, right? So there's a lot of ways to get fat. It can be avocado, it can be olive oil, it can be nuts and seeds, it can be, other fatty fish and things that are quite healthy for you, or it can be things that are not. So I think it's important to eat healthy if you're going to eat keto, and often that can be problematic. There's a sort of a last class of people who would want to consider this is for performance or optimal health. And there's this whole book called The Art of Low Carbohydrate Performance, which is really about athletes using ketogenic diets to improve their performance. Because, for example, if you're a marathon runner and you can load up 2,500 calories of glycogen in your muscles from carbohydrate, which is your backup stores. So if you don't eat, that seems like a lot, but you'll burn through that pretty fast if you're running. You might have 30 or 40 or 50,000 calories of fat on your body. So wouldn't it be nice if you could actually use that and you'd be like the ever ready bunny and just the Energizer bunny and just keep going, because you can have this long, steady, slow burn of fat. And so mobilizing fat for long-term high performance athletics is pretty well established. With that said, there's certain groups of people genetically that just don't do well with certain types of fat or with ketogenic diet. So, for example, some patient, I'll just give you a quick story. I had a patient who was probably a 50-year-old woman, couldn't lose 20 pounds, was very inflamed, pre-diabetic, super high triglycerides, very low HDL, which is a good cholesterol, bad LDL, and really struggling. So I said, listen, we've tried a lot of things. Why don't we try a ketogenic diet? Load up on the butter and the coconut oil, and let's see what happens. And of course, in the context of an overall healthy diet. Well, it was amazing. Even despite all that saturated fat, her cholesterol dropped over 100 points. Her triglycerides dropped 200 or 300 points. Her HDL came up, I think, 30 points, which you never see. And she lost 20 pounds, and all her cardiovascular markers, her inflammation, everything normalized and got better. I was like, wow, this is the best thing ever. And so then, I said, I'm going to try this on another guy who wants to optimize his performance and see he wants to try it, and I'll let him try it and see. And he was, this is a guy who was like, in his mid 50s, riding his bike, 50 miles a day, just killing it. And his numbers went haywire. His cholesterol went off the charts in a bad way. His particle size increased. It was quite striking. And so I talked to my friend and colleague, Dr. Ron Krauss, who's one of the foremost lipidologists in the world, brilliant guy. And he discovered the particle size thing where, not all cholesterol is the same. You can have, the same number on your lab test, but if it's made up of big fluffy particles, you're okay. If it's made up of small, dense particles, you're not. And he said, look, there's a lot of genetics here and we don't really even understand it all. And, we might be able to future take a blood test and check your genes or swab your saliva, cheek and see what your lipid tolerance is. Are you someone who really is what we call a lean mass hyper-responder? I'm one of those. I've just found that out for myself because I was like, started eating more fat, things got good, but then my numbers sort of gotten weird, and I was like, oh. So I probably 6-7% body fat. I'm very, I'm very active, but I think genetically, I think my family history also, I have a genetic family history of heart disease. I'm very cautious about eating like too much coconut oil or too much ghee or too much butter, but I will eat tons of olive oil, eat avocados, I'll eat nuts and seeds. So I can still eat a lot of fat. I just have to eat the right kind of fat. And I think there's going to be evidence in the future of how, you should eat. I mean, maybe you're not a saturated fat kind of person. Maybe you're more of an olive oil kind of person, or maybe you're fine with lots of saturated fats. And I think that's the take-home message here is, don't let your dogma overrule your biology. Don't let your ideology run over your biology. And I think if you think about, what matters is one, how you feel, and two, what your numbers look like. And no textbook or doctor or lab test, no scientific study can tell you except by looking at what happens to you, right? I always say that the smartest doctor in the room is your own body. It will tell you what's working and what's not. So don't get stuck in, I have to be keto and then do it and ruin your health, or don't get stuck in the idea I have to be a vegan and it's better for my health, where it may not be for you. So I think it's important to really personalize nutrition. So keto is here to stay. It's not like every other trend. It's like, oh, everybody's keto, and that's probably a bad idea. I don't think it's for everybody, but I do use it very often therapeutically in my practice. I think it's extreme to be on all the time for people. So I think people can go in and out, and people can play with what works for them. But I do think that it's a very powerful therapeutic diet, especially as the antidote to the sugar and starch Lollapalooza we're having in America right now.
Yeah, absolutely. Thank you so much for that extremely detailed answer, Dr. Hyman. You literally answered every single one of my multi-part parts of that. Thank you. Yeah.
Sorry about that.
No, it's good. It's perfect. We love it. So with that, I'm going to hand it over to Drew for the next question.
Great. The next one's on autoimmune, Mark, but I actually have one follow-up question to what Darcy was asking you. And that is, if people want to dig in more into the topic of lean mass hyper responder, and they might have seen that, for instance, that they were trying keto or trying like the eat fat, get thin type of diet approach, and their numbers weren't heading in the right direction, they're looking for some more resources. Is there anything that you could point them to? Does Ron Krauss have any books? Are there any other people that are out there that have written deep on this?
One of the most incisive, smart, and technical thinkers about this is my friend Dr. Peter Attia, and he's got a podcast, but he's also got a blog. And I would encourage you to sort of Google Peter Attia lean mass hyperresponder and check out what he has to say. He does do some of the blog shows on this, but he's also written many articles on his website. I think he's a great start. And within his articles are just tons of references so that you can follow the trail if you're really interested.
Okay, great. We'll have the link to that on Dr. Hyman Plus, so everybody can check it out. All right, pivoting over, we have a bunch of questions on the topic of autoimmune. And we want to kickstart it off with just the big picture. Folks asking after watching the longevity docuseries and exploring their general health is that, can autoimmune diseases actually be reversed?
Yes. Absolutely. I mean, I can tell you that just even from personal experience. And I developed an autoimmune disease and I don't have it anymore. So for sure it can. And I've been doing this for 30 years and I've seen so many people, when they get to the root cause, fix it. Now, in traditional medicine, we don't believe that. We believe once you got it, you got it. It ain't going away. We can manage it. We can suppress your immune system with medications. We can help you with the symptoms, but there's no real reversing it. In fact, they often will say, don't even look at your labs. If you have antibodies against your own tissue, don't recheck them because they're always going to be elevated. They're never going to be normal, and don't worry about it. But whether it's Hashimoto's, which is an autoimmune thyroid condition, or even more serious things I've seen over and over, this is just not true. When you follow the functional medicine model, it's a very powerful tool to help you to address the root causes and to reset the immune system. So what's an autoimmune disease? Well, it's basically a disease where your immune system gets confused and starts attacking your own tissue, whether it's your liver, your kidneys, your brain. MS is your brain, right? You've got your joints, which is rheumatoid arthritis, your skin, which could be psoriasis, your white blood cells, which can be a different kind of autoimmune disease. So there's all sorts of different autoimmune diseases. There's 80 million people with some type of autoimmune disease. It's probably 3 times the amount of people with diabetes in this country. And the reason is that we live in a world where our immune systems are being completely derailed by a whole host of insults: petrochemicals, toxins, our diet, the high levels of gluten in our food, antibiotics, C-sections. All these disturb our gut function, which leads to leaky gut and often autoimmune disease. So it's a really common set of problems, but it's often siloed because you go to all the specialists and nobody's like an inflammologist. They're specialists in MS, or they're a specialist in colitis, or they're a specialist in, rheumatoid arthritis, or they're specialists in psoriatic arthritis, or whatever the sort of specialty is. And it's really unfortunate because there's often common roots. And so from a functional medicine perspective, the joke is, it takes a lot of aspirin to make a feel better if you're standing on a tack. The treatment is taking out the tack. And the other part of that is if you're standing on 2 tacks, taking one of them out won't make you 50% better. So let's say you have gluten that's causing inflammation, but you also have mercury. If you take out the gluten, you won't be 50% better. You got to deal with all of it. And that's really what we do in functional medicine. And there's a whole cascade of autoimmune diseases that are growing in this country that we're starting to call pre-autoimmune disease. We used to, talk about diabetes, then we have pre-diabetes. We had hypertension, we had pre-hypertension. Now we have autoimmune disease and pre-autoimmune disease. And what's awful about it is that doctors will say, well, yeah, you might get it. It seems like your body's not happy, but you're not really sick enough now to give you medication. So come back when you're more sick. That's basically what they do. For me, it's like, whoa, something's going on here. Let's get to the root cause. And we start to dig and look for the 5 main causes of some type of autoimmune disease, which is some type of toxin. So it could be heavy metals, it could be mold toxins, it can be pesticides. They're often called autogens. It can be allergens, things you're eating in your diet that cause damage, like gluten, dairy. It can be environmental things, even like mold. It can be also in infections or changes in the microbiome. So it can be Lyme disease or viral illnesses, or it can be just imbalances in the gut flora itself that drive the damage to the lining of the gut that let all the poop and food particles to get across the bloodstream and start to activate your immune system, and then you start to create all these autoimmune diseases. So gluten itself can create over 50 different diseases and many autoimmune diseases. And it's often masquerading. Like people come in with rheumatoid arthritis, I check their gluten thing, and they have celiac disease. Well, they get off the gluten and their autoimmune disease goes away and their rheumatoid arthritis goes away. So it's really important to look at these root causes. In addition to those things in the gut, and the disturbance of the microbiome, it's often poor diet. We eat a very inflammatory diet, and there's many things in our diet that are challenging. For example, a lot of foods have emulsifiers in them, and there are food additives and thickeners and emulsifiers. It turns out these things can be very damaging to the lining of the gut, cause leaky gut, and have been linked to autoimmune diseases, whether it's carrageenan or others. Even if it comes from seaweed, it's still a kind of a weird thing that you shouldn't be eating. And then, of course, stress, and any kind of physical or psychological stress is a problem. And so all those toxins, allergens, microbes, stress, poor diet, all those triggers interact with your genes and your susceptibilities, because there are genetic risks and increased risks for example, Hashimoto's or various autoimmune diseases, to kind of create the expression of it. But, like for example, celiac is an autoimmune disease, but everybody who has the gene doesn't get it. 35% of the population has the gene. Only 1% get full-blown celiac. Why? Because maybe those other people haven't had the insults that have damaged their gut that allow the problem to start unfolding. So maybe they've been healthy over their life. They haven't had antibiotics. They're not full of toxins. Their gut is healthy. They're going to maintain their barrier and not end up in trouble, whereas the other people might. And about 20% have gluten sensitivity. So autoimmune disease is a huge problem. And from a functional medicine perspective, it is one of the things that I love to see, because it's often so easily treated and the results are so dramatic and remarkable. We just published a paper out of Cleveland Clinic comparing our center's results with autoimmune disease compared to the traditional rheumatologists there, who are some of the top in the world. And we had better outcomes from pain and outcomes and well-being and so forth, which is pretty impressive, considering, we're sort of competing against like the all-star team there at Cleveland Clinic. And I think that it just speaks to the power of food. And I remember speaking to this rheumatologist in UCLA recently, and I get these calls from patients. Would you talk to my doctor? And I'm like, okay. And I don't know if they're going to be friendly or aggressive and this guy was like, oh my God, Dr. Hyman, I just so happy to talk to you. We've been using food with our patients and we're seeing such dramatic results when we put them on an elimination or anti-inflammatory diets with our autoimmune diseases. And I'm like, and when you go to most traditional rheumatologists, they're like, diet has nothing to do with this. Don't worry about what you eat. It's not related. It's so powerful. So, I think that for me, I love seeing these patients. And I just tell you a couple of quick stories. One was a young girl I saw, was 10 years old, and she had basically autoimmune everything. It's called mixed connective tissue disease. So it's all your connective tissues, so her muscles, her skin, her liver. I mean, every connective tissue is everywhere in the body. And she had arthritis, she had dermatitis, she had hepatitis. I mean, her blood cells were affected, and it was just, this girl was just miserable. And she was 10 years old, and she was taking horse doses of steroids and chemo drugs to shut off her immune system, and another drug to prevent her blood vessels. So she had vasculitis. She also had, an autoimmune disease of her blood vessels, the connective tissue, to make sure her blood vessels wouldn't clot, or to dilate her blood vessels. So she's on all these pills, and no one ever said, well, why is this girl so inflamed in the first place? Well, it turned out she ate horrible diet, tons of sugar, dairy. She loved sushi, so she had lots of mercury-laden foods. And little kid had mercury issues. She had a leaky gut. She had gluten sensitivity. She had taken lots of antibiotics, so she had yeast in her gut. So he basically put her on an elimination diet, cleaned up her gut, got rid of the mercury, fixed her nutritional deficiencies like vitamin D. In 2 months, she was symptom-free. In a year, she was completely off all her medications. It was better than ever. And what was striking was all her numbers came back. So she had often with an autoimmune disease, you'll see 1 or 2 of these autoantibodies elevated. She had like all of them. And I can list them all, but they're kind of technical. But she had like probably a dozen autoimmune antibodies that were just off the chart. And they weren't just like a little elevated. They were just like, redlining. And after a year, I just checked it all again. And it was like, everything was normal except for one, which was still slightly elevated. And I was like, wow, that is really incredible. And I just talked to her. It's like 10 years later, and she's, doing great, graduated from college. And so I just wanted to check in on her because I hadn't heard from her. I was like, how you doing? And it was just amazing to see these people get better, and then another person, it might be something else. Like I had another person who, for example, had ulcerative colitis, and I tried all my normal gut repair tricks and functional medicine. Nothing was working. And we checked his heavy metals, and he had high mercury. And when we got rid of the mercury was causing the autoimmune disease, and he got better. Other people I've seen, for example, with Lyme disease or other tick infections that are undiagnosed, and then you treat them with either antibiotics or other treatments, and they get better. So the potential is really there to really help so many people. And I would say, do I cure everybody with an autoimmune disease? No. But would I say that we can dramatically improve the quality of life, pain, inflammation, and symptoms in almost everybody? Yes. And are there a subset that are completely cured? Absolutely. So I just think that if you have an autoimmune disease, it's important not to just stop at the traditional method, but to really look at some of these other approaches. And some of my colleagues have written books about this. Amy Myers, The Autoimmune Solution, and also Susan Blum has written another book on autoimmune disease. So there's a lot of good functional medicine content out there to help you figure out what's going on. And sometimes it takes a little detective work, but do not just sort of sit back and go, this is my fate and I have to suffer.
Great. Fantastic. I'll also add Terry Walls into that mix, who's been on your podcast.
Oh, yeah.
And she has a lot of great content out there. Even though she went through progressive MS, her dietary intervention and protocol is used by a lot of people who have autoimmune conditions that are not MS, and we'll make sure we link to all those folks.
Yeah, I mean, just to give a background on that, Drew, I mean, this woman was a doctor, was in a wheelchair, reclining wheelchair, basically about to go off on disability for the rest of her life. Started reading a little bit about functional medicine, tried the diet, and within a year, she was not only out of her wheelchair, but she was riding her bike 20 miles a day. She's running around the world teaching. She's, basically revolutionizing our thinking about MS and treatment of neuroinflammation. But you're right, it's really applicable to so many different autoimmune diseases, because it's really the same principles of how do you create health and reduce inflammation.
Yeah, one thing I really like about Terry Wall's program, Dr. Terry Wall's program, is that is really her emphasis on especially what is an expansion on the traditional functional medicine autoimmune protocols, really talking about why you really need to hit those 9 cups of fiber a day. And for a lot of people, she says that she didn't get better until she started including things like organ meats inside of her diet, which she found to be super essential to her recovery. So I think there's some unique things that she brings in that a lot of people have tested and found success with. So great answers on the autoimmune, Mark. We are going to go to the next topic. So I'll pass it back over to Darcy.
Awesome. Thank you so much, Drew. And something that I noticed, Dr. Hyman, that you talked about a lot in your all day today and in your previous answer on autoimmune, all has to do with gut health. So the next question that came in frequently in our community was asking all about, 1, how to create optimal gut health, but 2, also how to really impact the bacteria Akkermansia.
Yeah. Okay. Well, I think we should start at the top, and we go all the way down to Akkermansia first. This is kind of, what is that? People are going to tune out, but we'll get to that. There's a very important bacteria among the hundreds and hundreds of species that live in there called Akkermansia muciniphila that creates a coating on the lining of your gut and is critical for maintaining the integrity of your gut, preventing leaky gut, reducing inflammation, helping fight cancer, autoimmune disease, metabolic issues. So it's a really important bacteria, and we'll talk about it. But the gut is sort of the latest darling of the scientific community. There's just billions of dollars being spent on microbiome research, on understanding the gut. And it makes me kind of laugh a little bit, because we've been doing this for 30 years in functional medicine, and everybody thought we were totally crazy and we're all quacks. And what do you mean you're treating the gut to heal autoimmune disease, or treating the gut to heal obesity? Or it's like, wait a minute, how does that work? And now it makes sense. So we basically have about 100 times as much bacterial DNA as our own DNA. There's about 110 times many bacterial cells. There's about 2 million, maybe. There's like 20,000 genes we have. There's probably about 2 to 3 to 4 or 5 million genes that the bacteria have in your gut. And they're all producing proteins, doing things, and they get absorbed and they interact with your biology. And if you were to check your blood test, you'd probably have 30 to 50% of the analytes in there coming from the microbe world, which is kind of shocking. It's not something you measure on your regular lab test, but when you check all these different things, they're in there doing stuff to our brain, to our metabolism, to our hormones, to our mitochondria, to our immune system. It's really quite striking. So keeping a healthy gut is critical for long-term health. And most cultures have known this. I mean, Hippocrates said this, Ayurvedic traditions say this, Chinese say this. Any ancient healing systems are often very focused on the gut. And the problem with our gut in America today, and increasingly around the world, is we live a gut-busting lifestyle. One, we eat a diet that's very, very low in fiber, which is the basic food for the good guys. So we used to eat about 150 grams a day. Maybe we're lucky we eat 8. There's a guy named Dennis Burkitt who studied Africans who moved to the city versus the hunter-gatherers, and he found that when they moved to the city, their stool weight went from 2 pounds to 4 ounces, and that correlated with all these horrible Western diseases. So, that's a correlation, but it's quite a striking image of 4 ounces versus 2 pound poop, and what that means about your diet. But we don't eat that. We also eat tons of things that damage the gut. All the processed foods we're eating, all the sugar we're eating, the chemicals in our food like carrageenan and other things which actually can really damage the lining of the gut. So there's a lot of things that really are going on that actually can have a huge impact on our gut that are quite bad in our food supply. And not to mention glyphosate, which is sprayed on 70% of all crops. Glyphosate is a microbiome toxin. It also destroys the microbiome of the soil. It's Roundup. It's sprayed on most plants in our agricultural system. So those are all things that are damaging our gut. And then, of course, we're born by C-section, so we don't get inoculated. 30% of us, we get lack of breastfeeding, which is important for the gut. Just for example, breast milk alone has these non-digestible starches called oligosaccharides, which formula doesn't have. And they're not human food. You don't absorb them. They feed the bacteria in the gut. And so this is all these things we're starting to learn. And then we start piling on antibiotics, when kids are little, with ear infections and sore throats and this and that, damages the gut. So you end up, by the time you're a grown up, you're in trouble. And the patients who I see have the most immune dysregulation are the ones who are, often urban kids. When you look at people who grew up on farms or in third world countries, developing countries, they have very low levels of autoimmune disease or allergy. And there's a great book written on this called The Epidemic of Absence, which means the absence of all the good bugs in our gut. And so, we really are in a situation of tremendous gut disturbance. And we see the worst cases of autoimmune disease and allergy are people who grew up, for example, in urban environments, never got a farm exposure, born by C-section, no breastfeeding, early antibiotics. And then you just see the whole cascade of allergy, irritability, maybe acne, more antibiotics. And then you start to see more serious autoimmune diseases start to develop in the late 20s, 30s, 40s. So this is a classic story we see all the time. So we really need to look at our lifestyles and see, is it a gut busting or a gut healing lifestyle? And of course, it's the obvious stuff. It's a whole foods diet. It's lots of fiber. It's prebiotics, probiotics in our food. And then, of course, it's dealing with stress, because stress plays a huge role in disturbing the microbiome as well. If you can get a leaky gut just by being stressed, and they've shown this in young military recruits where they march them overnight for miles and miles, and then they check their leaky gut in the morning, and they're all like, their testosterones are dropped, their thyroids are a mess, and their microbiome is off, and they have tremendous amounts of leaky gut. So we need to look at our lifestyle, and then I think, we need to understand that we're just in the infancy of really understanding all the ecosystem down there and how to work with it. And I'll just sort of take you down into, a story about Akkermansia, because it's very fascinating. Before I do that, I also want to explain how, basically we tend to grow a lot of bad bugs because of our lifestyle and diet, and not enough good bugs. So the way to fix that, as I said, is dietary primarily. That's the biggest thing you can do to change your microbiome. So it's including lots of high fiber foods, prebiotic foods, which is like artichokes, asparagus, jicama, seaweed, plantain, and a lot of other foods which have very special kinds of fibers that feed the good guys. And then probiotic foods like kimchi and sauerkraut and miso and pickles and so forth, or even taking pre and probiotics. And polyphenols are the other component, and these are often overlooked. And I discovered this when I got very sick, and our team and I put together a product actually that combines the prebiotics, probiotics, polyphenols, and immunoglobulins, which are like natural colostrum, to help reset the gut. And polyphenols are this class of compounds. There's 25,000 of them found in plant foods. They're also found, by the way, in animal foods who eat plants, which is fascinating. It's a whole other topic. And these phytochemicals have different properties and do different things. And it seems like they also feed the good guys. And one of the important ones that we have in our gut that I mentioned at the top of the question was this Akkermansia. And when it's low, you're more likely to be overweight, have an autoimmune disease, get cancer. it's kind of a big deal because it really protects you against this leaky gut problem. And it turns out you cannot take it as a probiotic, although I think there are companies working on it. But you can grow it by feeding it the right stuff. And this particular bacteria loves these polyphenols. It particularly loves cranberry, pomegranate, and green tea, among others. And so you can literally take these as powders, as supplements, or as I put it in my shake in the morning. And it's just striking how powerful it is to start to fertilize and grow these good bugs back. And one of the interesting stories that's come out about Akkermansia is that if you are someone who's got, let's say, a stage 4 cancer and everything else has failed, there's a treatment that is often being used called immunotherapy, or they call it checkpoint inhibitors. And they basically activate your own immune system to fight the cancer. Well, it turns out if you have low levels of Akkermansia, you don't respond to these drugs. So it's literally the difference between life and death is your microbiome. And a friend of mine had a mother with stage 4 cancer who was uterine cancer and failed all treatments and was trying the checkpoint inhibitors, didn't work. And he was a doctor and he knew about this research and he checked her Akkermansia. It was very low from a stool test. And he gave her all these polyphenols, grew it back. Then she tried the treatment again and she was cured of stage 4 cancer. So when you think about the potential of really understanding the microbiome and understanding some of these bugs, and Akkermansia is just one of them, it's really, really important. And so there are, tests you can get for this. They're not, unfortunately, they're not things that your traditional doctor will likely do. They're often functional medicine stool tests. And there's various companies out there that are testing some of these things. So there's ways of learning about it, but it's one of those things that I think, we're just beginning to understand. And when you think about the complexity, it's overwhelming. I mean, there's literally, like I said, millions and millions of genes, hundreds and hundreds of species, all doing different things, all have different properties. And like the Akkermansia is just one of those. And so imagine as we start to peel back the layers, what we're going to learn about how do we sort of create the healthy inner garden that allows you to thrive and be healthy as you age.
That's great, Mark. Thank you. So I think that's it. Those are all of our questions for this week's Ask Me Anything. Thanks for tuning in, everyone. Again, please submit your questions to Dr. Hyman Plus. We will be doing this again soon. And thanks for everyone for tuning in.
Thanks, Mark.
Thank you.